1, 2, 3. Good. Eyes open.
Oh God.
There, that might give you a bit of a dizzy feeling.
Oh God.
Okay. And breathe.
Friends, 1 in 10 people throughout their lives suffer from vertigo. What is vertigo? Have you had it? Do you have it chronically? Can it be cured? We're here with physical therapist Jean Sopart, who, besides being a great friend, is the one who treats my patients. Many times I've had patients who, when you recline them to a certain point, start feeling dizzy and say, "Doctor, sit me up, I'm getting dizzy." That type of vertigo, that type of dizziness is exactly what you treat, right?
Exactly.
So today, Jean is going to tell us what vertigo is, how it's treated, if there's a solution or not, and how you at home can detect it. We're going to see all of that in this video. Jean, thank you very much. So tell us then, mainly, what is vertigo and how can someone at home detect it?
Look, vertigo is a perception, right? From the patient, it's a perception. I'm telling you, a very nasty one. Very nasty. If I remember experiences that patients tell me, they say it's the worst experience of their lives. And it's the perception that everything around you is moving, and it can happen at any time of the day. I've seen patients here who tell me about their experience with it, and they say no, they don't move anymore because of it. They don't want to move their heads because they don't know when it might happen to them. And they know that when it happens, it's very, very unpleasant. So they are very still patients, very rigid. They say, "I don't move my head because I don't know when it'll hit me."
Oh, how awful. And in the end, does it happen with any head movement, or is there a certain specific movement that triggers it?
Well, here we're talking about a certain type of vertigo, right? It's called positional or postural vertigo. That is, it's the vertigo that hits you when you move your head. And the typical thing is when the patient lies down in bed, they lie down with head rotation to the left and head rotation to the right. It's the patient who's in that bed and turns over in bed, and then the whole room starts moving. That's vertigo.
How awful.
So that's the positional one. It's when you move your head and then the vertigo hits.
Please explain to us what different types of vertigo there are. I mean, very broadly, right? Which can be cured, which can't, and then we'll move on to how it can be cured.
Well, here we're talking about what's called BPPV. It's Benign Paroxysmal Positional Vertigo. That's what it's called. It's the diagnosis. And that's I'm telling you, positional vertigo. Meaning we see it when the patient or the patient describes it this way. It's when they move their head and then the vertigo hits. It's this type of vertigo that we can treat here through physical therapy.
Okay, so does it happen to the patient every time they make that movement or just sometimes?
Sometimes. Sometimes it hits, sometimes it doesn't. Well, you can understand that there are cases that are more acute or more chronic. For an acute patient, any movement like lying down or getting up triggers the vertigo. There are patients where it's more sudden, and it can last for days, weeks, or even months.
And does it have any specific cause? For example, does something happen that suddenly triggers it, or does it just come out of nowhere? How exactly does it happen?
Look, it's a dysfunction of the vestibular system.
Okay.
It's the vestibular system that's malfunctioning, because that's what vertigo is. It's when the brain, your brain, misinterprets the environment and makes you feel like the walls are moving. But it's your brain that makes you perceive that everything around you is actually moving. And the problem is an issue with the vestibular system. The vestibular system is a very important system for giving you a sense of balance and your stability in space. And sometimes it happens like this. Well, they're crystals called otoliths. They're otoliths, like little stones that are traveling in the fluid of the vestibular system. And the problem is when they're not properly positioned, they move around. They move when you move your head, and that, well, it sends incorrect information to the brain, and the brain gets confused and gives you the sensation of vertigo.
And do those little stones form naturally, or is there something that causes them, or is it normal to have little stones?
We have otoliths, but sometimes these otoliths break loose, and then they travel inside the fluid of the vestibular system. Normally, this fluid is very, very clear. And sometimes there is the presence of these otoliths, and that's the source of the problem. Why all of a sudden are there these otoliths in the vestibular system? Well, there are several factors, right? For example, a patient might say it happens after a plane trip or after scuba diving.
Oh,
In Cancun, right? And so in those cases, pressure changes can cause these otoliths to break loose, and then you have these otoliths traveling inside your vestibular system. Well, it can happen after an ear infection. It can happen after sudden head movements. You go to an amusement park and you're left with vertigo for a few days or weeks after the park.
it happened to me once, yeah. Yeah, for 2 or 3 days, I couldn't stop. I mean, you'd lie down in bed and everything would move horribly.
Exactly, that's benign paroxysmal positional vertigo. It can go away, right? It can go away on its own over time, and sometimes it doesn't. Sometimes it doesn't. And so the treatment for that is a very well-known treatment, right? It's not a new treatment, it's a known treatment where the goal of the treatment is to eliminate these otoliths. And so we have to carefully move the head in a very specific and deliberate direction because the semicircular canals, which are part of the inner ear, are not actually closed off. This means that the way we move our head really matters in this situation. And so the otoliths travel through this area, and our entire therapeutic job through the maneuver is to evacuate these otoliths. It's a very causal treatment. We are treating the root cause.
Pero,
The problem is that with everyday movements, because of the range of motion you have in daily life, these otoliths will stay inside the vestibular system. They're going to stay in there.
okay.
So you need a movement that's a bit extreme, a bit wide, in order to be able to evacuate these otoliths. But in daily life, it's very rare that you're going to make these movements. That is the justification for the treatment.
Excellent. Well, friends, obviously you're not going to want to miss out on seeing how the test is done. We're going to do some tests on me. I'll be the patient, and Jan will explain a bit more about what he's doing and why he's doing it. So that you at home, first of all, know how to diagnose it, obviously not in a very exact way, but at least so you can say, I have this, or I don't, or I might, and go see a professional about it, right? In this case, here in Querétaro, well, Jan has his clinic here, and you're more than welcome to come, but if you live elsewhere, well, he can also recommend who to go to, or tell us which specialist can look into this. So let's see those movements, let's see that diagnosis, and I hope you enjoyed this video. All right, so the first step is
Seated.
the patient is seated.
Yes.
Very well.
So I'll stabilize your head, and I'm going to ask you to cross your arms over my arms.
Like this.
Like that. That's it. Perfect. Okay, and now I'm going to lay you down on your left side. Okay, and you'll end up looking toward the ceiling. What I ask is that you don't close your eyes.
Okay.
Ready?
Yes.
Up. There. Eyes open. Okay, let's go back. I ask you to keep your eyes open because I have to watch the eye movement and see if what's called nystagmus occurs. It's a very rapid eye movement that the patient obviously can't control, but we see it, and that confirms that we're dealing with benign paroxysmal positional vertigo.
Do they get vertigo at that moment?
Yes, the patient can definitely experience the sensation of vertigo then, right? But we're here to help them relax, though yes, vertigo can hit at that moment.
Even if they don't feel the vertigo effect, do their eyes start moving?
It's possible that during the maneuver they don't feel vertigo, but yes, it's still the correct diagnosis. So then we continue the maneuver to free the otoliths from the vestibular system.
Okay, do you only do it to one side or do you do it to both?
We do it on both sides because the problem can affect either the left or the right vestibular system. So we have to perform the test on both sides. What I'm doing now are the diagnostic tests to see if it's on your left side or your right side. Okay, ready. Go ahead, Federico. Keep your eyes open. 1, 2, 3. Up. There. All good?
All good.
Okay, let's go back. Okay. Okay, yes. All good.
Good. I don't have vertigo.
It seems you don't have vertigo, right?
Okay, now let's suppose that in either of the two movements, right or left, the patient experiences vertigo or starts getting dizzy. Or do they usually tell you when they have vertigo?
Exactly. They tell me and I see it in the patient's eyes.
Okay, in that case, what's next?
So once we have the diagnosis, whether it's the left or right vestibular system, that determines the maneuver we're going to apply. and then we start the otolith repositioning maneuver, right? And that's a maneuver that lasts 6 or 7 minutes with 6 different positions, where we'll take the patient from position A to position B to position C. And in each position, well, we wait a few seconds, 30 to 40 seconds. Why? Because we need time for gravity to pull the otoliths down. Like that, inside the fluid of the vestibular system. And once they're down, we move to another posture, up. And there, the otoliths move again until they're completely cleared out.
So the otolith is in the semicircular canals and it travels. And where does it come out?
The whole goal of the treatment is to position the otoliths within a space in the vestibular system where their resorption is much faster and more effective.
So they're reabsorbed and then...
And they disappear. Okay. And the patient, usually after that, well, there are 24 hours where you have to be more or less calm, not move your head too much. But then the patient says, it's gone. I can lie down. I don't have the symptom anymore. So the effect is actually quite fast.
Wow, okay, that's great. Hey, and a question, well, 2 questions. First, do all patients have it on just one side, or can they have it on both?
Generally, it's on one side. It can affect both. Generally, it's on one side.
Okay, and I guess you cure it, but it can happen again and they have to come back to you to do the maneuver, right?
Generally, the patient has vertigo, the treatment is done, and it disappears. And then years go by without having the symptom.
Oh, that's good.
It's true. Sometimes the maneuver has to be repeated once or twice.
Okay, hey, and are there medications that control the sensation of vertigo?
That control the sensation? Yes, but they don't cure it. So yes, there are medications that can help with the symptoms, right? You take it and you don't feel the vertigo, but it doesn't cure the vertigo. Here we cure the vertigo because the technique actually clears out the otoliths. So it's really a causal treatment, symptomatic and causal.
And besides, the most important thing and what I like most is that you don't take medication. Because you know that on my channel, I always talk about trying to do the least amount of medication use, especially when something can be cured without having to medicate it.
It's mechanical.
Wonderful.
Rather, it's a treatment for a dysfunction, and we treat it through a functional mechanical treatment. So it's evacuated almost naturally, right? Through movement.
I'm impressed by the technology of having been able to discover it, right? Because the part of discovering it, seeing the way you can remove it, and especially that it's not with medication. I mean, mechanically, you move it like this, like this, like this, and it's out.
And we know how to move because normally everyone has the same anatomy. So the maneuver is very universal. Universal, yes, it's always the same because we know how to move your vestibular system to evacuate these otoliths. So you more or less have to know where the otoliths are positioned, but it's more or less the same maneuver for all patients.
Great. Well, let's do an example. Obviously, we won't do them all because there are several, but so people at home can see what it's about, it doesn't hurt. It's not a process that hurts you.
Let's see.
I'll be the patient event. Ready?
Go, then go. Cross your arms. There, okay. Buddy, like this.
Let's give it a try.
Ready? 1, 2, 3. Up, 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 up. That's it. Eyes open. Very good. And there we wait 30, 40 seconds to give the otoliths time, well, to position themselves in the vestibular system. Go, and then the next position is face down. So we're going to ask the patient to lie completely face down on the table, lift their legs, and end with their forehead there on the table. Okay, so you go.
Like this? Just like this?
Lift your legs and on the table, and you end up face down with your forehead.
Like this?
That's it, but firm, like that. That's it, go. Very good.
You're messing up my hair now.
That's true. 30 seconds like this.
Okay.
Very good, and then the next maneuver is very easy. It's head rotation to the left. Go. 30, 40 seconds like this, and then the next position, sit on this side of the table. So you can take your legs out.
Okay.
Go, and I'll help you with the head position. You come out, up, looking to the left, go. Eyes open. Sometimes at that moment, the patient can feel the vertigo quite strongly. There is a lot of movement of the otoliths, and we finish facing forward. And there we did a whole washout of the liquid system that's inside your vestibular system to clean your vestibular system. It's like a cleaning of your vestibular system.
For example, if someone has vertigo, you take it away.
You take it away.
Is there a consultation where they have to come and do some exercises to reinforce this cleaning you're talking about? Or simply, if it's already gone, don't mess with it anymore?
Look, many times we need a second session. I'll explain why. Because once there are otoliths in the vestibular system, if days, weeks, or months pass, the brain, your brain, tries to adapt to the presence of these otoliths. So there's an adaptation of your brain to that, and that's why people often have somewhat strong vertigo at first, and then the intensity decreases, but they still have this instability. But in reality, it's your brain that is adapting to the presence of the otoliths.
Okay.
And when we clear your vestibular system, the otoliths are gone, and your brain is once again a bit lost.
It needs to be recalibrated then.
It needs to be recalibrated. Your brain needs to be reset. And that's the idea behind the second session. It's a very different session where we give the patient exercises to stimulate your visual, vestibular, and proprioceptive systems to test your brain a bit, so we can teach your brain that there are no longer otoliths. It needs to reset itself based on a clean vestibular system. There are exercises, right? With slightly abrupt head movements, but the patient no longer has vertigo, and we retrain your brain to a clean vestibular system.
Wow.
And those are exercises.
Now, Jan, many patients who have come to see you have told me that you also use virtual reality. Meaning, you put goggles on them and everything? Can you explain a bit what that's about?
Well, virtual reality is indeed a new tool. That is new, where what we do is use this technology to place the patient in a, virtual environment. And so we can sort of program the entire environment we want around the patient to reprogram the patient's brain. And it's a truly interesting technique because it really does involve a reprogramming of your brain.
All right then, let's do us.
That's it.
So I'll put this on.
Yes, of course. Absolutely.
Very well. And you're going to set up a program for me now.
Ready.
Okay.
Okay, explain to me, what do you have around you?
Right now, I'm seeing some trees, some clouds that are moving, some mountains.
Okay, get ready, Federico, because I'm going to start moving the trees, okay? So I'm kindly asking you to be very calm, very relaxed, and extremely stable on your legs, making sure you feel balanced and secure. Once you are ready, we'll slowly start moving the trees together, okay?
Oh, God.
That might give you a bit of a dizzy sensation.
Oh, God.
Okay, and breathe. You're calm here, just like your arms here. Breathing. And let's see, we're going to do an exercise. I'm going to ask you to focus on a tree. So you focus on it and move your head with the tree, with the movement of the tree. Ready? Go. Focus on this one. Go. Very good, very good, very good. All the way to the right. Go. Back to the left. That's it. And focus on a tree. Go, go. So the tree doesn't move. Excellent. And there you understand that we're bombarding your brain with visual information, kind of putting it to the test, right? Okay, testing it a bit. Okay. You might feel a little vertigo, but that's why we're right here next to you. And we rehabilitate, we re-educate your brain to a visual stimulus that's a bit intense for your brain.
Yeah, it was very intense, but it's very interesting.
Right, so here we are, as you can see, in outer space, where, we kindly ask you to carefully follow a moon, using both your head and your body movements. Take your time and make sure to move smoothly and gently, keeping your focus on the moon as it travels. This will help you get the most out of the experience. Great. That's oculomotor coordination. So through ocular vision, you're moving your head and your body.
Okay.
And there we re-educate the brain for oculomotor coordination.
Magnificent. Wow, it's incredible that with this technology you can help people.
Where's the moon? You're lost in space, Federico.
Merrily. There it is. Okay.
And there we can vary all the parameters
The speed.
to put the patient to the test a bit.
Oh my God.
It's fast here.
You're overdoing it, Gene.
Exactly. Let's see. I'll turn it down a bit for you.
Hey, it's super interesting that with this technology you can do this. It's impressive. Gene, you really don't know how interesting that was. I think for many people, it's something completely new. They'll have vertigo and they might have been told, perhaps even wrongly, that it can't be cured, that it's something that stays for life. People who will think that medication is the only way to treat it. And what better than being able to reverse this type of condition, right? And that you can cure a patient, brother. How can people find you on social media? What's your handle?
Well, we're here at Clinica Kine here in Querétaro, and the Instagram is at Clinica Kine, or, well, we have a website, which is www.clinicakine.com. Well, all the details to get in touch with us are there, right?
Perfect. Do you do video calls too?
Yes. We have video calls for patients who are out of town. We can treat patients remotely as well.
Perfect. Well, thank you so much as always, and thanks for taking such good care of my patients because they're truly grateful. And I'll say it again, this changes their lives because it's completely different. They arrive, get treated, we lay them down, they have no problems, and for us dentists, it's truly a relief to treat them. Because we work sitting down, and it's hard, and they got dizzy and weak. And there are times we've had to cancel appointments, important surgeries, because the patient arrives with vertigo. So thank you very much again. Friends, Clinica Kine. If you like this video, share it with people who have vertigo and who you know are suffering from this, because there is a solution. Obviously, they might not be candidates for the treatment. There will be other types of vertigo, but what better than an expert being able to diagnose it? Maybe a video call, or you can refer them to someone else treats it. Well, I hope you enjoyed this topic. Subscribe. Like the video if you found it interesting and important, and I'll see you in the next video. Take care, everyone.